Patrick, great to see you, mate.
You too.
A lot happening at the moment in the world of AI and healthcare. Tell me, for us paupers over here in London, what's going on in Boston? What are you seeing?
Boston, North America, world at large. A lot of great conversations. Also, a lot of interest in AI right now. Almost every single client, and in particular, our healthcare clients are asking about, implications and applications of AI. A lot of them have already worked in it, given their research areas for health and medicines. But I think when we start to look long term, we have to really focus on four really big key areas. One, human augmentation and biohacking, designing our next generation bodies using AI data analytics. Secondly, building longer lives. Human longevity is a key theme, and making sure whether we're fighting diseases or just proactive health. Lastly, I think the whole concept, or second to last, I should say, is the whole concept of digital twins. Building models to understand how medicines, therapeutics, and the world at large come together to design new healthcare systems. And lastly, making sure that everyone has access to equitable and accessible healthcare are really four key themes that we're going to see long term.
It's really interesting you raised that. I'm seeing similar trends and developments over here. But in particular, reflecting on what you said there, I'm seeing some particular themes emerge too that really tie all those areas together. First of all, you talked a fair bit about data, and I think all those areas depend on knitting together large volumes of data from diverse sources, often data that's moving at pace. The next theme I'm seeing and hearing is organisation. Combining all of that data really depends now on organisations moving in a much more fluid way, both in how they collaborate between units and also work with their partners. And then finally, augmentation. The technology, AI models themselves bring tremendous value, but what they also depend upon is human beings to provide a strategic view of the output from that analysis they provide and take the decision about the route that the organisation or the healthcare institution should chart next. So a great deal of possibility out there, but also a great deal for organisations to think about as well. From your perspective, what are you seeing as some of the important decision points that your clients need to focus on?
Well, two things right off the top, and as you just mentioned. One, AI strategy is data strategy, understanding inputs and outputs and how to use and leverage their own data. Secondly, AI is a silo buster. The way you talk about governance and people working together, you got to bring diverse groups of people that share common data to understand it. And lastly, just a fine point on it, making sure it's a human-centric narrative, like understanding that all AI does require, humans as well, and the elevation of our own creativity and possibilities.
I think that's right. I think in a world where we're seeing AI proliferate, being successful means taking the broadest possible view that you can of your data pool, both inside your organisation and, again, to your point a moment ago, the kind of partners that you can collaborate with. That's where the possibilities emerge and also the potential risks that you need to think about as well. So a great deal of opportunity out there, but a great many challenges to think about as well. It's really exciting times.
It's time for us to build things is what it is.
I think so. I'll look forward to it, mate.